Hello, it's nice to see you guys. I'm Kevin Aragill. I'm the licensed acupuncturist. So looked over your case a little bit because I've had reports from other clinicians. So I'm going to ask you just some general questions about kind of key points. My understanding is that you had quite a few headaches and some vomiting from fairly early on, like about age 5 or so. Is that right?
Yes.
Well, the vomiting was when she was younger, and then she finished from when she was about 5 for about 3 years. They called cyclic vomiting, and the headaches are more a recent occurrence.
And
two separate ones.
did anything happen that started the headaches or that you think might have started the headaches?
Well, about 6 months ago, I got a concussion while playing volleyball. Someone had spiked the ball at my head.
And I think she was getting headaches prior to that, but then they kind of ramped up.
So that kind of got worse from that point on?
I'm thinking, yeah, possibly.
Can you tell me just a little bit about the headaches as well? How they feel, where you have the feeling?
I get like a sharp throbbing pain where like my temples are and like behind like my right eye.
It's unpleasant. And does anything happen before they come on?
I get a tingly numbness in my fingers and my lips.
Sometimes I can tell the day before that it's probably going to come on because she gets to be a little bit crabby, grumpy. I don't
Okay,
know.
so there's
Not always.
some irritability sometimes.
Something.
I see from your notes it looks like your menstrual cycle is fairly normal. When did that start?
Around age 12.
Around age 12 or so. And do you notice whether the migraines can ever be associated with your cycle?
Yes, one day like before I can like my headaches will start to get really bad.
Okay, so they might start the day before. Have you ever noticed that they might start, for instance, during the first day of your flow or something like that?
Yeah.
Near as I can tell, and we didn't notice this at first, it's probably going to be either a day prior to or the first day of her menses. Yes. Not all the time, but
No,
more
but
often.
that can
Yes.
happen sometimes. Okay.
Yes.
And then if you can tell me a little bit about your bowel movements, how they are, things that you notice around that.
Sometimes it can be difficult to start, and they're sometimes like loose and smelly, and can sometimes relieve migraine symptoms.
So sometimes if you're having a migraine and you actually have the bowel movement, you can get some relief from that?
Yeah.
Okay. Now that we've finished up kind of the main points of the interview, I'd like to go ahead and take your pulses. I'm going to look at your tongue. And then when we're done with that, I'd like to do just a little palpation of your abdomen, which we can do over at the table if that's okay with you. So when I take the pulses, basically we're just looking at the behavior of your circulatory system in relation to everything that's going on in your body. So from a traditional Chinese medicine point of view, we look at the quality of the pulse in different positions under the fingers to kind of understand what might be going on in your body. It's a very old way of understanding how things are going on in the body. And then I'll also look at her tongue a little bit with a pen light. That's okay. And the abdominal palpation, just because she has some of the issues with bowel movements, I want to palpate a few acupuncture points in this area. We're big nail polish fans. I'm just going to turn your wrist. You can relax. I'll just sort of wiggle your arm around a little bit. So what I'd like to do now is just take a look at your tongue. I'm just going to use this pen light, and when I ask you to put your tongue out, just put it out in a relaxed way. You don't have to push it out really hard or anything. I'm going to take a little look at it, and then I'll pop it back in. And just before we do, I'm going to ask you to curl it up so I can look at the underside. Is that okay? Okay, great. Go ahead, okay, that's great. And then go ahead and protrude it out. Thank you. Oh, perfect. That's great. Thank you very much. So Morgan, what I'd like to do now, I'm going to palpate or press on areas of your abdomen, sort of from below your rib cage to right above your pelvic bones here. And if you could do me a favor and just lift your sweater up. And what I'm doing is I'm looking for areas that are tender So I'm going to ask you a little bit about where things are sore, where they're not sore, and so forth. So I'll be kind of pressing all over this area. I'm just going to scooch this a little bit. So is this tender here?
Mm-hmm.
Okay. Here too?
Yeah.
Okay. And how about this area?
Mm-hmm.
Okay. And let's palpate here.
Mm-hmm.
Okay. And this, how about this right here?
Yeah.
Now, of the areas that I pressed, which feels the most tender to you?
Middle, right there, yeah.
Right there? Okay. So Morgan, here's what I think we're seeing. And I think you can, well, let me talk to you a little bit about how this is organized. You have the early childhood history of the cyclic vomiting, which I
Yes.
understand has gone away. But from a Chinese medicine point of view, especially when we're developing, we think the areas associated with digestion, which in Chinese medicine are the spleen and stomach, can actually be taxed by that. It can cause what we call the process of qi going counterflow. That is, the normal movement of the body to be disorganized by that. And that may have predisposed you a little bit to the types of headaches that you were having before you had the concussion. The concussion is fairly consistent with some of what we're seeing. Your pulse has a string-like and hesitant quality. We associate that with blood stasis, which can be produced both by sort of the problems with digestion and vomiting and so forth in the past, as well as the sharp blow to the head more recently, along with changes that occur in the body as menstruation begins and continues.
What does blood stasis mean?
Blood stasis basically is the idea that there are areas where blood is not moving smoothly, where circulation is impaired. In migraine, which frequently can have a vascular component or a circulatory component, this is one way that Chinese medicine will look at this.
All right.
If we see the signs associated. So it's not necessarily serious, but it actually can be a process that we can identify and provide treatment for. So basically, if we look at where you are at this point, we would say that you essentially have a situation, and again, these are Chinese medicine terms, they're very traditional ideas. Feel free to ask, because they sound weird, right? So that's perfectly fine. We say that the liver is overacting on the spleen, that there can be blood stasis in the liver and gallbladder channels. That has a lot to do with that sensation, very focal pain that you have there, as well as the experience that you have sometimes of the menses making the pain come on, and also the pain being relieved by the bowel movements. Right? So all of those things kind of fit together in that kind of picture. And we think there's probably a little bit of heat as well. But from the appearance of your tongue, there are a few stasis signs there as well. And then finally, when we examined you, there's a point, it was known as the alarm point of the stomach. It's REN 12. If you remember, we pressed there, it was a little tender. And you also had some tenderness at the side areas, the flank. So those kind of fit together in a clinical picture that suggests basically that we might be able to be helpful with acupuncture. Can't obviously guarantee anything, but generally speaking, in the range of 6 to 8 weeks with weekly treatment, we would probably see the beginnings of clinical changes. What we look for with managing migraine is a reduction of frequency. That's kind of our key marker, and reduction of severity. Do you have any questions for me?
So for acupuncture, needles scare me, so does it hurt?
Well, let's look at that a little bit. And have you ever seen an acupuncture needle?
No.
Okay. So one of the reasons that people sometimes find acupuncture a little scary, definitely the word needle, because they are needles, but they're not like hypodermic needles, the needles you get shots with. You can go ahead and take a look at this if you like. They vary in length depending on where they're going to be put, but what you can see is the tip of the needle is very, very fine, and it's not a cutting edge like a hypodermic needle, it's tapered. So when we insert it, mostly what it's doing is actually parting the skin rather than cutting it. It's a little bit like a sewing needle in that way. So there can be discomfort, there can be pain on the skin surface, like a little pricky or pinchy feeling, but mostly that's it. There's not usually any kind of sharp, stabbing, cutting feeling or anything like that. And usually what people feel is a little bit of an ache, like somebody massaging a sore muscle, that then goes away, and generally you wind up with a fairly relaxed overall feeling. Would you like me to show you what it looks like to stick an acupuncture needle into someone?
Sure.
So before we put an acupuncture needle in, we usually clean the skin surface. We use some alcohol, and I'm going to needle a fairly famous and commonly used point on the hand, and usually wait for the alcohol to dry, because otherwise it can be very unpleasant for people. So I'm doing this one-handed. Normally I might stretch the skin a little bit, so you don't need to be too alarmed by what you see. But the needle just pops right in. There you go.
Did you feel anything?
I did, because normally I will stretch the skin a little bit with the other hand. That keeps the needle from pressing on the skin as much,
Okay.
so it's like the faintest pinprick feeling.
Okay.
But other than that, it's not very dramatic. This point is a little, can be a little more reactive or sensitive. It's one of the points we might use on you, so you would feel maybe that slightly stronger pressing feeling there. But, you know, in almost every case when we're treating somebody for the first time, we usually select points that are a little less reactive. At the same time, because we want to help you get over your headache, we got to pick the best points that we can use for that. So, are there any other questions that you might have?
That was pretty amazing, wasn't it?
Yeah.
Well, so you think that acupuncture would help Morgan?
I actually think it would. The data on acupuncture and headache, especially in adults, is pretty good, and particularly in the area of migraine. There are not a lot of studies for kids your age, but given the history that you've described and your presentation, I think it's likely to be somewhat useful for you.